So EMDR, it's a trauma resolution therapy, right? It's I use it to help go through the harsh memories, the harsh traumatic incidences. The way I utilize it is I try to help the client first ground themselves with safe place, with containment exercises to at least try to get them stable.
Mhm.
And then what we do is I typically do a trauma timeline. I think most therapists, most EMDR therapists do a trauma
Yeah.
timeline.
Like the
And to
10
get
most things you remember. I know that's how my EMDR specialist did for me.
Mhm. Right.
So,
I go a little bit longer, right?
wow.
Yeah, the way I do it, I give them the time. I give
Okay.
them the time to like from 0 to 50, from 0 to 35, like just whatever you consider traumatic. And then
Mhm.
from there, we'll pick the 10 most.
Okay.
And then we'll use bilateral stimulation. And what that is the left and right, move your
Which one do
eyes
you
or
use? Do you use the light? Do you use the hand? Do you use both? Or do you online, you just have a thing going back and forth?
I have access to all of them. Most 90% of the clients I work with I
Mhm.
use the light bar. I used to use
Okay.
my arm a lot, but then,
Hmm.
the
Get
shoulder
tired.
starts to hurt.
Yeah.
Yeah, you get tired. And so I invested into a light bar. I typically see resolution from 3 to 5 sessions.
I love
And
that.
typically I see resolution 3 to 5 sessions. And we use what's called the SUD score, subjective units of disturbance, basically how intense or
Hmm.
disturbing
Yeah.
that particular incident we're processing. And then again, I work anywhere from substance abuse, trauma, sexual assault, earthquake, natural disasters. I once had a client, he said, I experienced the worst tornado in American history. Like, okay, sure. Went to Google, like, whoa, the worst tornado in American history.
Wow.
Like, and he survived this tornado in a gymnasiums, and his entire town was leveled.
Oh,
And so, I picked up EMDR as a modality to be honest with you, to protect myself, right? I started when I was working with children, the last 2 years I worked with children. You're interested in trauma, right? Here you go. And like, oh, okay,
oh,
cool. And so you're listening to
yeah.
molestation,
Yeah.
abuse,
Oh, yeah.
you're listening to a lot of those trauma stories. And I felt I always needed a modality to help hasten
Yeah.
the work, but
Right.
also sometimes to kind of put a barrier
Hmm.
between myself and that work.